For some patients in hospital wards, especially those who are bedridden, deconditioning is a major problem. This is where a lack of physical activity leads to muscle weakness, decreased endurance, and other health complications.
Deconditioning at first happens when people who are normally mobile, for example, and they come into the hospital and they don't move normally as they should, their muscle tone and function decrease. When you think about deconditioning, first thing you think about is physicality of it, but actually it affects the brain and the brain function. There are studies that say deconditioning prolongs the length of stay of patients unnecessarily.
But what if there is a way to combat deconditioning without the patient even having to leave their bed? That's where Lightboxes come in. Lightboxes are simple, portable devices that emit bright, full-spectrum light. The hope is, by incorporating light therapy into their daily routine, patients will become less likely to experience deconditioning.
Hospital lights is different from home environment and from what people will be used to. We are looking at how light boxes can influence the lighting environment within a ward area and how it impacts our patients and staff alike.
So know that patients who are becoming deconditioned and spending a lot of time in bed, they may be feeling very dozy or not very alert, and as a result they may spend more of the day asleep and then they may have a disturbed night. So we want to try, and the important thing is to distinguish between day and night. And we know that the light environment has very positive effects on how alert you feel, your energy levels, your mood, but it's also really important for synchronising your sleep and wake patterns as well. We're going to do what we call an objective measure, where we're going to use a mattress sensor placed under the mattress that will monitor the patient's their physiology, so their breathing rate, their heart rate, but will also tell us about the type of sleep that they're having and how much sleep they're having. And it will also tell us how much time they spend in bed. So if the light has a positive effect on energising them and getting them to move around more, then we'll be able to see that. But we're also going to use different scales. So we're going to ask people how they feel. Do they feel sleepy, or do they feel more alert with the lights on? How does it make their mood feel? And we're going to ask them that twice a week.
The main benefit that I would like to see is for patients to spend less time in hospital, and having that quality of life, I think, would be great.